I'm going to share a few ideas about the Wisconsin public health model that we've developed here at the University of Wisconsin School of Medicine and Public Health and our Population Health Institute. So this is the model that I've been using here at Wisconsin, and the one that underpins our Improving Population Health blog. On the horizontal parts of that diagram, we not only want to improve the mean, the overall components of mortality and health-related quality of life, but we need to pay attention to the disparities or the variation in a population on those elements. And in addition, the model breaks down disparities to say that we're not only concerned about race and ethnicity, which is an important disparity domain, but socioeconomic status, geography, and gender. On the right-hand side, the determinants or factors, which are identical to those in the Evans and Stoddard model, and then at the bottom, indicating that it's policies and programs that impact on these factors and these outcomes in order to change both of them. Now, how can these models be used, and how have they been used effectively over the recent period? I'd say the first thing is that the models have been used to really increase our understanding about particularly the multiple determinants of health. And as I indicated before, in the early 90s, we were still, many of us, very much in a medical model frame where healthcare was the main determinant, perhaps some issues about behaviors and lifestyles, but this full-blown understanding of the relationships was not complete. So that's been important over the last 2 decades. We have used it specifically here in a number of projects at the University of Wisconsin. The most prominent one is our county health rankings. And this model that you see on the board is the model that we use for that project, derived from both of the previous ones. This is a project. For 10 years, we actually ranked Wisconsin counties using a model like this, and 2 years ago, we were asked by the Robert Wood Johnson Foundation to rank the health of all the counties in the country, and we've done that for 2 years. And you'll see in this model at the top, the outcomes are, again, mortality and non-mortality factors, which in this we weight half and half, and then the factors that produce those, similar from the other models. Health behaviors, clinical care, social and physical environment, genetics. And then we drill down on the right in this particular model to produce the metrics that go into these county rankings that we do for every county. And you should visit our countyhealthrankings.org website if you're interested. If you do, it'll look like this. And you can drill down on any county in the country and get a snapshot of the health outcomes of those counties. This is the state of Washington and how the various counties rank. And then we also rank every county on the factors that contribute to those outcomes. And you can actually drill down underneath this to see specific data elements that produce those rankings.